thanks very much. It's a real pleasure and an honour to talk to so many distinguished people with so much experience of this condition. It's also lovely to see so many old friends and faces from Norway and Belgium and everywhere, and to see Anne McIntyre again, who with Alan Franklin taught me so much common sense stuff about ME in the days when I was just finding my way. So it's really nice to be here, and thank you very much. It's not so nice to talk to you all when you're wanting your dinner, but I'll try to be as quick as possible, but just touch on some rather important things. As Richard said, I'm tending to get called upon rather more than I'd hoped following my retirement, and I really thought things were going to get better after the CMO's report in this country, and for some reason they just haven't. And it must be something to do with the fight back of the psychiatric brigade, with cognitive behavioural therapy being the be-all and end-all. And some of the stories I'll tell you today will touch on how useless those treatments are. I'm going to just say a few things in general about what the existence of very severe ME can teach us and the others. And then I'm going to illustrate it with about 4 or 5 cases. And the main problem is that patients with very severe ME are treated either one way or another way by the medical profession in this country. They are either neglected, and I'm seeing cases around the country, young adults who haven't seen a doctor for 3 years because the GP won't visit because he's not well enough to come to the surgery, and the hospital doctor refuses to have anything to do with it. It is absolute terrible medical neglect. But they're probably rather fortunate. The ones who are treated worse are the ones who are, especially children and young people, who aren't believed. And because they're not believed, alternative explanations have to be found. And these alternative explanations are not very nice. I've got to juggle a pointer and a microphone, so if I get it wrong, I apologise. Anne McIntyre told a beautiful story about a boy in Australia, 14-year-old doctor's son, I believe, who got ME and was taken around a lot of experts in Australia. This was a long time ago, so this is no reflection on anyone here today. And at the end of the year, someone said, "You must have found out a lot from seeing all these clever doctors." He said, "Not much. They don't understand it, but I've noticed one thing. It's a condition which induces an acute emotional disturbance in doctors confronted by it." Now, everything that is true of mild and moderate ME is true of severe ME with knobs on. It's bad enough having mild and moderate ME, having disbelief, persecution, and all those things. But if you're really, really ill and people disbelieve you and persecute you, that is adding insult to injury. And that's why severe ME is a real challenge to everyone. So I say, those that the Lord wishes to destroy, he first drives mad. If they're doctors, he confronts them with a case of severe ME in a child, and they go mad. Very little research on it. The psychiatric lobby who do all the research won't touch these kind of people with a barge pole. They don't exist. And the thing I hate most is this therapeutic fallacy that we have ways and means of making you get better or else. And the evidence is really terribly weak. I'm not going to go into a critique of the PACE trials and things like that. Let's acknowledge that a mild, convalescent, ambulant case of ME, you can get to the clinic and talk to people a bit, maybe a bit better at the end of 6 months than otherwise. But just because it might help some mild cases does not mean that severe cases have to be given an overdose of it, an extra vigorous graded exercise. And yet this is the logic that I'm seeing in the kind of cases I'm talking about. And then, of course, once you believe in your own therapy, you start turning nasty when it doesn't work. So if they withdraw from therapy, you blame them, even take them out of your figures. And if parents disagree with the treatment, they're accused of being negative towards professionals. Remember the famous cartoon in the John Cleese book on family therapy, where the waiter is pouring some red wine over one of the customer's heads, and the customer says, "Stop pouring wine over my head." And the waiter says, "Why are all the guests so paranoid today?" But time after time, the mother is negative to doctors. She's anti-professional. It's because she knows what's right for her child. It's as if doctors have actually become much nicer people in the last 20, 30 years in this country. We've become more touchy-feely, find out the patient's expectations, their wishes, do all this sort of thing. But as if ME gives you that Custer's last stand of all that is paternalistic and oppressive in medicine. And it's said to be respectable to do it. I heard of a GP in Devon recently who rang up a charity worker and said he was really worried. He thought he was developing ME. Said, "Okay, well, hard luck, what's the problem?" Said, "Well, me and my colleagues have always treated our adult patients with ME with such contempt and rejection that he's too scared to tell his colleagues he'd got it. And he was going to give up medicine and keep quiet and tell his colleagues he's going off with depression, which has less of a stigma." He actually admits that that's the way we treat people. There was a boy in Scotland who was 12, moderately severe, was told that if he signed up to this treatment program where he coloured in every hour in a different coloured crayon for 6 months, there's a 90%, he was promised a 100% cure rate. And he was tired out with all this colouring in and got worse, and the sleep hygiene made him worse. So the parents said, "Do you mind if we stop it now? It doesn't seem to have helped." And the paediatrician immediately called a child protection case conference, because to ignore medical advice is child abuse. I had to go up there, do diplomatic work, and get them back under the first paediatrician, who'd had to refer this boy, to the local ME expert. It's these local experts that are often the problem. And then, of course, with children, parents sabotage the treatment, and at the last resort, we can always say it's Munchausen by proxy. Now, Munchausen by proxy is real. It is as rare as hen's teeth. I have seen 2 cases in my entire career of 40 years, and yet it is being bandied around for anyone that is slightly out of the ordinary. So there's this over-promise of efficacy of any sort of regime in mild and moderate ME, and if you don't get better, it can't be ME. Okay? So you have to change the diagnosis. And idiopathic pain syndrome has suddenly been invented as a new diagnosis, and the treatment apparently is vigorous physiotherapy. And if you get worse, it's either Munchausen or pervasive refusal syndrome. Just want to talk about these cases. I'm going to miss out the 4th case, because all of you who've seen the film Voices from the Shadows will have heard that case described by the actor's voice on behalf of the father, and that girl is still severe. But I think a lot of you will have heard first of the late Emily Collingridge, beautiful 29-year-old girl who'd had ME since she was 6, and actually had been treated, with some exceptions, for most of her period, of most of her teens, by a very, very good GP with a lot of support, at home, tube-fed, ripple bed, catheterized, high doses of morphine for pain. Through all this, she writes a book on severe ME, a brilliant book. And I was asked to see her to help the transition to the new GP when the good old GP retired. I was horrified to hear this GP said all her problems were due to drug side effects, and he regarded ME as a somatization disorder, full stop. And I attempted to persuade him the opposite, but wasn't able to. But I did think, when I saw Emily, she was operating at 1% functional capacity. If one thing goes wrong to make her worse, she will die. One thing went wrong. She developed renal colic and had to go into King's College Hospital, where she was treated to normal hospital routines on an acute medical ward by a doctor with no expertise in ME. And 6 weeks later, she died in King's College Hospital of ME. Shortly after I retired, I was called to see a girl in Scotland, and here she was diagnosed with moderate ME quite confidently by the local paediatrician. But she got worse. So the local paediatrician panicked and instantly referred to psychiatry. And the psychiatrist, this girl mutated incredibly from being a case of ME into something else. And she was called the Pervasive Refusal syndrome. And they took a court order to compel her to be admitted to the psychiatric unit, where they have ways and means of treating the pervasive refusal syndrome. This girl had acute hyperacusis, and I went in to see her on the psychiatric ward. She was curled up in the fetal position, tube-fed. She wasn't the pervasive refusal syndrome, she was severe ME. And every time the door outside closed, a shudder went through her body from the noise. But the child psychiatrist said she wasn't allowed to have year defenders because that would increase her withdrawal. We actually got that court order reversed. She went to a benign nursing unit and has made a full recovery. The 16-year-old girl from Sussex was a very severe case, lying in a darkened room. You had to go in with a pen torch, but a bit like Rosa Amor we were talking about. And the paediatrician couldn't believe that this was real, that she could be so sensitive to light. So she told a very highly placed judge in this country that she needed a court order to admit the child to her hospital for physiotherapy. And the judge, in her wisdom, gave the court order. I had already seen her by then. I put in contrary medical evidence which was ignored, and she was admitted to an ordinary district general hospital to have physiotherapy to make her get better. She was very, very severe. She naturally got worse. She finally fought her own battle by telling the physiotherapist she was in breach of her professional ethical code. And the physiotherapist, after 3 months, threw her hands up and told the doctors, "I'm sorry, I can't go on with this." So then the paediatrician was left with a child who was worse. The court was left with a child who they promised they could make better, but they couldn't send her home because that would admit losing face. So they said she'd have to go to another unit. To save their face, she came all the way to Durham at her own request, and we kept her for 6 months, where we persuaded my nurses to be nice to her and to treat her gently. One of the nurses finally, after we talked about how you handle severe ME in hospital, said very wisely, "So you're really telling me that everything I've been taught in my nursing care for other conditions is wrong for this?" I said, "Spot on. You're absolutely right." This girl, after 6 months with us, to save the judge and everyone else's face, went home and is still severe today. This is a current case in the southwest of England. Lovely lass, good surf rider, lovely family, the most normal, gorgeous family you could imagine. Got 2 younger brothers, they're all keen surfers, parents still married, not a psychological blot on the family anywhere. At the age of 10, she developed ME and got steadily worse with repeat virus infections. And one paediatrician thought it might be ME and referred it to an ME specialist. Of course, she didn't see a doctor, she saw an occupational therapist, and the occupational therapist said, "I think it could be ME, I'll ring up the expert." Rang up the expert and said, "No, she doesn't quite have enough criteria for ME. We'll call it the idiopathic pain syndrome and admit her to the local pain unit for physiotherapy." She walked into the pain unit and a week later came out bedridden with the vigorous physiotherapy she was subjected to. So not even getting the right diagnosis from the expert. She got steadily worse. This was last July, and by September she needed tube feeding and was admitted to hospital. And again, the expert over the phone said, if she needs tube feeding, that can't be ME because that's outside the spectrum of ME. Talk about not wanting to believe that severe ME exists. So the local paediatricians don't allow this girl the diagnosis. Her current diagnoses are idiopathic pain syndrome. I'll just show you what she looks like. Just like all the others. She's not got severe ME though, because she's tube fed. idiopathic pain syndrome. She can't move her arms and legs because she's so weak, and that is acute hysterical conversion disorder and needs urgent referral to a psychiatrist. And just in case you haven't got enough diagnoses, it's probably Munchausen by proxy as well, and they've referred to social services who are conducting child protection investigation. That's happening this month in this country. Okay, going abroad. Some of you will have heard of this girl. If after you've heard what I've said, any of you would like to sign a petition as a last-ditch attempt to try and persuade the German authorities of the error of their ways. Lovely girl. You can actually see she's still in a wheelchair at this stage. She developed ME at the age of 10. She's now 14. But this time, April last year, she was like this, able to sit in a wheelchair, able to travel, able to feed herself, able to cuddle her dog and her pony, and able to talk. And sadly, she suffered a severe spontaneous medical relapse last May and went right downhill. Both her initial illness and the relapse appeared to be triggered by Epstein-Barr virus. By September, she needed tube feeding at home. There was a crisis in November when the tube was blocked and mother couldn't get any help. And sadly, and understandably, kept her at home for too long so that she actually needed a court order to save her life and get her into hospital. And in November, she was admitted. She was admitted to a pediatric neurology ward where they subjected her to an activation regime because the Cochrane Review and British NICE guidelines say that graded exercise is the treatment for severe ME. They agreed with the diagnosis and they gave her, and every day she is visited by a team of therapists, a teacher who tries to educate her, a physiotherapist who bashes her around, a psychologist who talks to her about her negative feelings, and the nurses who actually put her into a chair and wheel her around the ward to keep her upright to make sure there's not enough blood running to her brain. No, to help her get used to orthostatic intolerance, I should say. I went out in Regina Close, who nearly everyone here will know, has done a tremendous amount of help supporting the mother, advising her, and she's just dedicated her life to this case. And she got me to come out, and we did our best. I talked to the professor, I came back a second time and gave evidence to a judge, and I thought I had been heard. And I explained that treatments that might help with mild and moderate ME might make severe ME worse. And I think, well, we thought we did quite well in court. But currently, I should mention that mother was accused of sabotaging the programme between November and January, and therefore was limited to 30 minutes visiting rights a day from January. So once mother's sabotage was removed, she should have got better, but she got worse. She's still tube-fed, she's still bedridden, she's vomiting, and she often loses the power to speak. And since the court case, they've actually ramped up the treatment even more. Listen to this. We're going to build up her muscle bulk by putting her in a vibrating chair, like a power plate in the gym. And she has that every day. And the ability of the doctors and nurses to see improvements when none exist is frightening. And this is the poor girl. I went to see her on the second occasion. She was much worse than I'd seen her before. And I can tell you, she is not responding to activation therapy. Currently, mother has had her parental rights removed completely, and there is very little prospect of her getting them back. So, what lessons can we learn? It's very real. We know it can affect anyone. It's not their fault. That's why the psychologists hate this condition, because, I don't think many people in Auschwitz developed ME under the acute emotional stress of being about to be gassed. But what kind of psychological stress would you need to produce all these cases of severe ME and they can never find anything. They can postulate that maybe she'd been sexually abused or something, but there is not enough psychological evidence for proving that it causes severe ME. And it does not respond to any form of rehabilitation, and patients can die. Some suggestions. We should study it more, document it more. We should lobby more on behalf of them. And the psychiatric lobby should be challenged as to how they explain the phenomenon. And perhaps on a very simple level, we should reinvent the concept of patients being visited by doctors at home. The English girl, the surf rider, has not been visited once at home by her GP or her consultant. The GP says it's practice policy that we only visit cases of terminal illness and broken legs. So the girl was being dragged to hospital to be weighed, being carried into the car, carried from the car into the hospital, put on the scales for weekly weighings on the orders of the hospital consultant. So I always remember during the miners' strike when Neil Kinnock was addressing the striking miners, and he said, I'm not actually interested in any glorious defeats. I just like a few small victories, and that's how I'd feel. In fact, he was making the point about seawater being a risk factor for enterovirus, and how many cases she saw in the southwest of England who were surfers. Very interestingly, that particular girl, it presented with a diarrhea illness, which was very profuse, followed by what I thought was a Bornholm-like condition causing lateral abdominal pain, which was very, very severe. And I kind of retrospectively called it just that. Meta is describing her severely affected daughter. How many years was she in the darkened room?
6 years.
Six years in a darkened room, who, out of the blue, with immunoglobulin treatment, made a near total recovery over 6 to 9 months. And then this was followed by a 14-year-old boy in Oslo who had a similar miraculous recovery. The reason I mentioned it was in my early days I had 6 very severe cases, and I always felt as a doctor that if a case is really very, very severe, you have to pull out all the stops and offer them anything that might help at all. And there were 3 trials on immunoglobulin, 2 of which showed some efficacy. Those 6 cases all did well. I didn't give them to my mild and moderate cases. Then towards the tail end of my career, I had 2 more severe cases. Again, I gave them immunoglobulin, and they did very, very well. And that's why my interest in immunoglobulin was rekindled. But it's very interesting. The CMO's report had a literature review in which it said the evidence for immunoglobulin was at least as strong as for CBT and GET. And in the final report, it made no mention of immunoglobulin. I mean, talk about academic bias. And if there hadn't been all the research money going into psychiatry, there should have been more trials on immunoglobulin. It's a very simple thing to do. I think the evidence is strong enough at the moment to offer it to very severe cases. I've been talking about it to Rosa's parents, and they just cannot get anyone to use it. And yet in Oslo, 2 doctors are willing to say, we'll try it. I think doctors' first duty is to try to make their patients better. If they've got any excuse for it, they should try and do it. Thank you, Matt. 12 years ago, I went to Australia to do just this talk about children being taken into care in England with ME. And Christine Hunter invited me. And since then, I'm in touch with Kathy Rowe, just recently, who's got massive experience of both pediatric ME and immunoglobulin. And firstly, it sounds as if her influence is so great that they don't have the kind of problems of persecuting families in Australia as we do here, although when I was there, they had just persecuted one family. But her influence is obviously very good, but also she has used immunoglobulin very, very widely and continues to do so.
And in the States?
Oh, I don't know about the States. The question is, can very severe patients be a fruitful avenue for research to help us understand the causes of ME? Partly, I was suggesting we should study them more because they teach us so much. But I suppose if you take a moderate case and a severe case, they've both got the same cause, then the research will come up with the same results. So I'm not a proper researcher, I'm just a clinician anyway. I once was lecturing in East Anglia, and they had the local acceptable face of general practice there because he was on their ME committee and he was sympathetic and he believed in it. But when I actually suggested to him that he should visit preemptively all his very sick patients who weren't fit enough to come to him, he said, "Oh, I'd never thought of that." I mean, sometimes just being able to visit and see and validate, even if you have, I always teach doctors, you have to deal with your own feelings of impotence and lack of therapy. Accept that, put it to one side, confess it to the family, and then say, maybe we can still help a bit. At least we can prescribe sympathy every 3 months.